So the topic for today is going to be thyroid disorders, specifically hypo and hyperthyroidism. And this is where your thyroid gland is located. So the basic definitions of hypothyroidism is a decrease in the secretion of T3 and T4, and hyperthyroidism is an increase in the secretion of T3 and T4. It's important to understand what T3 and T4 is necessary for to understand how our patients are going to present. T3 and T4 is needed for metabolism and energy production. So if you have too much T3 and T4, you're going to have a lot of energy. If you don't have enough T3 and T4, you're not going to have a lot of energy. So the patient with hypothyroidism or low T3 and T4, they don't have a lot of energy. They're going to be lethargic. They're going to be tired. They're going to have fatigue. They're going to gain weight because they don't have energy to burn the fat. They're going to be intolerant to cold, again, because they don't have a lot of energy. Their GI motility is going to decrease, causing constipation, and so will their heart rate, causing bradycardic. Patients with hyperthyroidism is going to present the complete opposite. They have too much T3 and T4. So they're going to have a lot of energy. They're going to be very anxious. They're going to be nervous, extremely irritable. They're going to lose a lot of weight because they're using up so much energy. They're going to be tachycardic, and their GI motility is going to increase, causing diarrhea. And remember, they're going to have the classic bulging eyeballs. So how would you treat these patients? Well, think about their symptoms, and let's do it step by step. So for the hypothyroid patient, right, low T3 and low T4, remember, they're going to be lethargic and bradycardic and weak. So I would put them on a monitor, especially a heart monitor, and do some vital signs. The drug of choice for these patients is Thyroid. It's going to help increase the T3 and T4. When you give Thyroid, it's very important to show these patients how to monitor for signs of hyperthyroidism, because you're giving them T3 and T4, and what if it's too much? So they need to know what to monitor for so we can kind of gauge overproduction or underproduction. So remember, again, these patients are going to be constipated, so the treatment for constipation is fluids. Remember, these patients are going to be cold, so we want to encourage a warm, comfortable environment for them. And since they're going to be lethargic, we don't want to oversedate by giving them narcotics or opioids. So how do we treat the hyperthyroid patient? Remember, these patients have too much energy, too much T3 and too much T4. So they're nervous, they're anxious. We want to encourage rest. These patients, it's okay to give them sedatives because they have so much anxiety and so much nervousness. But we should really try to avoid giving stimulants like caffeine because it's going to make matters worse. We do want to encourage giving them a high caloric intake because they're using up a lot of energy. And the drug of choice for these patients is going to be PTU, and another drug is iodine, and they're both going to help decrease the secretion of T3 and T4. Another drug that's often given to patients with hyperthyroidism is propranolol, and as you know, that is a beta blocker. But remember, these patients are going to be tachycardic, so it's not really that they have a problem with their heart rate, it's because that they're tachycardic from too much T3 and T4. And if nothing else seems to help, these patients might be a candidate for thyroidectomy or radioactive iodine.